This is a short video on how to spot the signs and symptoms of peripheral arterial disease, also referred to as PAD. According to the Heart Research Institute, PAD affects over 200 million people worldwide. Around 20% of the population in the over 60s age group will suffer from some degree of PAD. PAD is a type of cardiovascular disease that affects the blood vessels in the leg and feet. One of the main causes of PAD is atherosclerosis, which is a buildup of plaque or fatty deposits in the arteries, which can lead to a narrowing of the vessels. This reduces and sometimes blocks the blood flow to the legs. The reduction in blood flow to the legs can result in several signs and symptoms, which we are about to discuss. Achy leg pain or a cramp-like pain while walking or during activities. This can typically go away after a short period of rest. Both legs are often affected. However, the pain may be worse in one leg. Leg pain while at rest can also be another symptom. Weakness, numbness, tingling, or pins and needles may be felt in the lower legs and feet. The temperature of your feet and lower legs may feel cold and feel different in comparison to the other leg. There also may be changes in the skin. These changes may include loss of hair on your legs, and toenails are slower at growing. The color may change and appear pale and discolored. Sores and wounds on the feet and legs may take longer than normal to heal. Many people put these symptoms down to growing old. This is not the case. If you or the person you care for is showing any of the previous signs and symptoms, it is advised you discuss your concerns with a healthcare provider. You can talk to your local podiatrist, nurse, or GP if you have any signs, symptoms, or concerns of PAD. If they think you are at risk, there are a few tests that they will perform to confirm a PAD diagnosis. Diagnosis of PAD involves a few tests, and these are non-invasive. A physical examination of the lower legs and feet is completed along with a detailed patient history. A Doppler test is performed to test the pulses in your foot and ankle in both feet. An ankle brachial pressure index test will also be performed to measure the blood pressure in the patient's ankle and upper arm. The ankle brachial index test compares the blood pressure in the ankle with the blood pressure in the arm. A low ankle brachial index number can mean there is narrowing or blockage of the arteries in the legs. A diagnosis of PAD can be confirmed if the patient has physical signs of PAD, along with history of symptoms and an ankle brachial pressure index score of less than 0.90 or less. The diagnosis of PAD is serious. However, there are steps that the patient can take to help reduce the symptoms of PAD. Lifestyle changes, such as stopping smoking, increased exercise, eating a balanced diet, reducing alcohol, weight management, and managing other medical conditions, such as diabetes. Medications such as statins and antihypertensives may also be prescribed to treat the underlying causes of PAD. In the more severe cases, surgery may be required to restore the blood flow in the affected areas. If you or the person you care for are concerned or feel you are showing signs and symptoms of PAD, please speak to your local podiatrist or healthcare provider. Thank you.